I'm enormously excited about each of today's projects. First up is Community Solutions. Its goal is to try to end homelessness in 75 communities within 5 years. That is to find and sustain housing and support for every single person who needs it. Their audacious proposal involves knowing by name people who are experiencing chronic and veteran homelessness in the communities where they work. That sounds impossible. Understand they've been able to do that already in 15 communities. Let's hear from Community Solutions.
Before the pandemic, an estimated 568,000 people experienced homelessness on a given night, disproportionately Black and Native Americans. Now, the economic crisis threatens many more with the loss of their homes. We went directly to those experiencing homelessness, and what they described was sobering. The dozens of programs operating separately, each with their own roles, trapped people in a maze of homelessness. Despite everyone's good intentions, we were part of a broken system perpetuating homelessness, with money being thrown at a problem no one fully understood or was accountable for. That's why Community Solutions created Built for Zero, a movement of 84 cities and counties proving the power of an operating system designed to end homelessness. Built for Zero represents a new paradigm matched to the complex, shifting nature of homelessness itself. More than half of our communities are reducing homelessness, including red and blue communities of every size. We help communities make 5 changes to achieve and sustain zero homelessness. First, to define the problem correctly. Second, to build the right team. Third, to collect the right data. Fourth, to set the right aim. And finally, to close actual housing supply gaps using social impact capital. Built for Zero is poised to scale. We can help a critical mass of diverse communities end homelessness for one or all populations and make this goal achievable and expected everywhere by 2026. This is Ed Givens. He had endured life on the streets for 17 years when we met him. Thanks to the local team, he was connected to a home. A year later, we got this photo from Ed and an invitation to share his story. We look at it often to remember what's at stake: people reclaiming their lives. Homelessness holds a mirror to our broken systems, to racism, and to failures of accountability throughout our nation's living history. But ending homelessness as a nation would reveal something very different about us and our future.
So good to see that picture of a restored human smile. Up next is Project ECHO. Project ECHO is trying to make sure that critical medical knowledge is shared even in the most remote and underserved parts of the world. It has plans to try to positively affect the lives and health of over 1 billion of the world's most vulnerable people. Project ECHO's groundbreaking all teach, all learn approach has been invaluable, certainly in the global fight against COVID-19, and it has applications even beyond healthcare as we tackle social justice reforms, climate change, and any challenge where shared knowledge would be a benefit.
The right medical knowledge and expertise in the right hands at the right time could save millions of lives around the world. That's why I started Project ECHO. Today, ECHO partners in 40 countries operate more than 860 ECHO learning networks, addressing dozens of health problems ranging from hepatitis C and TB to cancer and HIV. Teams of experts at regional medical centers called hubs use video conferencing to engage with local healthcare providers, the spokes, in weekly, ongoing knowledge sharing, case-based learning, and telementoring. On-the-ground health workers have the expertise they need to treat patients with serious and difficult conditions. When the coronavirus pandemic struck, we pivoted our resources towards meeting the COVID-19 threat in countries around the world. In 2020, ECHO programs trained hundreds of thousands of health professionals in the COVID-19 response. But we need to do much more, and especially in Africa and India, where demand for ECHO is so high, and especially now as the COVID-19 pandemic further strains health systems in these places. We want to scale up ECHO in Africa and India, to meet the immediate threat of COVID-19 while building a strong foundation for stronger and more resilient health systems over the long term. These are the systems needed to address future pandemics and eliminate healthcare disparities. At ECHO, we have a goal of touching 1 billion lives by ensuring that all people, regardless of where they live, can get the care they need when they need it.
And now from Community Solutions, we have Roseanne Haggerty and Beth Sandor. And from Project ECHO, Dr. Sanjeev Arora and Dr. Elizabeth Cluett, and welcome to all of you. Thank you very much for being with us. I get to ask a few questions now. Let me put you on the spot, if I could right now, Beth Sandor, for a moment. All the finalist teams were asked to think deeply about disability inclusion. How did you run that through your mind? How did it change the solution you came up with to be more inclusive of people with disabilities, particularly in an area where I think we know it contributes in a critical way?
Well, our work has always been rooted in ensuring that people with disabilities have reduced barriers or no barriers into housing. We've always focused on the most vulnerable people living on the streets and in shelters and communities. But the process with MacArthur really pushed us to integrate disability inclusion into all of our work with communities, not just focus on housing alone. So every 6 months, we bring all 85 communities we work with together in person. And we were pushed to really see that as an exciting opportunity to integrate accessibility into our materials, our training, our coaching, and think beyond just the people experiencing homelessness to how we are working with our community teams as well. And so we felt really grateful for that push to have a different expanded lens on the work.
Elizabeth Cluett, let me ask you to talk about that, about disability inclusion and the way it's been confronted in Project ECHO, if you could.
Thank you, Scott. I think our experience was very similar. You know, we are founded sort of in a desire to democratize knowledge and really make sure that people in very rural settings that we expand access to knowledge everywhere. So for us, the access to the coaches and working with the MacArthur team really helped us dig in and say, okay, we have this amazing network. How can we think more systematically about how closed captioning or the way we talk about language can really shape the environment? And how can we really promote the leaders that already exist in our network to be champions for our community and share their great work? So we're really looking forward to this aspect of our initiative going forward.
Roseanne Haggerty, Community Solutions. Let me ask, well, why is there still homelessness in a society of such plenty? Maybe I understand that better after a year of the pandemic, but why does it persist? What are we not planning for, doing, providing for each other?
Well, Scott, I think we've been trapped as a society by the idea of the intractability of this problem, and that's created paralysis. But in fact, it doesn't have to be that way. More than 80 communities are part of the Built for Zero network, showing on a daily basis that communities can come together and reduce homelessness. We now have 15 communities that have ended chronic or veteran homelessness and are expanding to address the end of homelessness and what's going to be required for all populations. And what we see are the necessity of making two shifts. One, this should not be the exception, it should be the rule. And so our vision is that this be the norm everywhere, that communities are set up to solve this problem, not merely to react to it. And secondly, key to this is understanding that this is not a problem of broken people, but about broken systems that have not been designed to solve this problem. That's a problem we can fix.
And Beth Sandor, if I could turn back to you for a moment, what role does ending homelessness have, do you hope, in trying to build a more racially equitable future for the United States and other societies?
Oh, this is so important. Homelessness holds up a mirror to racism. We know that Black and Native Americans are vastly overrepresented among people experiencing homelessness. And solving homelessness means tangible progress on racial equity and justice. And that progress looks like us addressing the inequities in the homeless response system itself, but also working upstream with our partners in criminal justice, in housing systems, and healthcare to ensure that racial disparities in those systems are also addressed so that we're not seeing Black and Native Americans become disproportionately homeless. And so there really isn't an equitable future in which we don't end homelessness. So it's critical at this time, now more than ever.
Mm-hmm. Sanjay Arora, let me turn to you and ask Project ECHO. I'm just going to bet you've this past year has both confirmed a lot of what you've been saying and taught you a lot.
Scott, I think that we always thought that ECHO, with learners in 150 countries, more than 200,000 of them, it could be used in a pandemic, but it had never been put to the test. But once the pandemic came, we realized that the demand for ECHO all over the world just exploded. And we use it first for teaching our learners things about infection control, about how to do testing for COVID-19, how to, in low-income countries, how to reuse personal protective equipment. We taught them how to manage patients because the information was all new in terms of ventilators and steroids and later antibodies. More recently, we've been teaching them about vaccination and training a vaccine workforce, how to overcome confidence. And we've had, just in 2020 alone, 1.28 million learners in 179 countries who are being mentored right now on how to respond to this pandemic. And it has been a very gratifying experience. Of course, much more needs to be done.
Elizabeth Cluett, to help us understand, well, certainly we understand in this country and really all around the world, the way the pandemic has laid bare divisions that we used to verbalize about, but have seen in real time and at real risk to human life. I'm wondering what you have learned over this past year and how it's going to inform your work going ahead.
Scott, thank you for that question. I think one is the power of human relationships, as you said. We build communities of practice, and it's so powerful, people talking with one another, learning from one another. One of the amazing things about ECHO is, experts come and provide their knowledge about best practices, but the participants on the ground teach experts as much as as is learned the other way. So I think that's a really important lesson about democratizing knowledge as we go forward. That's the way we will get solutions to all these problems that we're discussing.
Yeah, because correct me if I'm wrong, but your design ideally is to act locally, right? Is to put power in the hands of people who are actually living through that experience.
Thank you, Scott. Exactly. To have partnerships on the ground who build communities of practice and local providers who help their patients get better care throughout the world.
Yeah, and I will come back to you one last time, if I could, Roseanne Haggerty. What do you hope municipalities in this country? Where do you hope they put the question of chronic and veteran homelessness as we return to post-pandemic life?
Well, this moment, Scott, is just so urgent for the question of how we restore our communities to be places of justice and of decency for all of our people. And so having in this moment investments in a public health system that protects everyone, in racial justice investments that do not leave anyone behind on the street, and helping communities at this moment recognize that this unusual, unprecedented opportunity with the American Recovery Act to invest in communities, in their infrastructure, in their systems, that this is the moment to really guide investments in a way that is designed to result in communities that are more just, more fair, more equitable. And designing for an end to homelessness is a moment we're in that we've never seen before. So it's so important that communities have this systemic view and that long-term goal, and really hold themselves accountable for that vision of a just and equitable community.
Thank you, all of you, to Community Solutions and Project ECHO, and good luck to you in your important work.